Good afternoon everyone, we are the group 5-7 and we are here to discuss the skin infection like bacterial skin infection and fungal skin infection. Types of skin lesions. Macules are flat lesions that are less than 1 centimeter in size. They are identified by simply looking at them and touching them. It doesn't involve any change in the thickness or texture of the skin. Areas of discoloration that are larger than or equal to 1 centimeter are referred to as patches. Papules, raised lesion, solid inconsistency of less than 5 mm in a diameter. A papule can have distinct or indistinct borders. It can appear in a variety of shapes, colors, and sizes. It is not a diagnosis or disease. Plaque, flat with elevated surface with more than 5 mm diameter, are raised red patches covered with a whitish buildup of dead skin cells called scale. They usually show up on your elbows, knees, scalp, and lower back, but you can have them anywhere. The symptoms of plaque: itching and burning, soreness, often a deep, non-specific achy feeling, swelling, and stiffness on joints where plaque are located. Treatments for plaque: proper hygiene, regular use of a moisturizer, oatmeal baths, and sun exposure while wearing sunscreen are all said to ease discomfort and keep skin healthy, although they can completely prevent plaques from occurring. Oral medication like antihistamine may also be prescribed to help control the itching. Nodules, rounded raised lesion more than 5 mm in a diameter. A nodule is a growth of abnormal tissue. Nodules can develop just below the skin. They can also develop in deeper skin tissues or internal organs. Symptoms may occur with nodules. A nodule on the thyroid may affect swallowing. A nodule in the abdomen may cause abdominal discomfort. A nodule on a vocal cord may change the sound of your voice. Sometimes you can have a nodule without any other symptoms. Types of nodules: lymph nodules, vocal cord nodules, thyroid nodules. Urticaria, wheals or hives, annular or ring papules or plaques with pinkish color, are reddened, itch wells that may be triggered by exposure to certain foods, medications, or other substances. Hives or urticaria are red, itchy wells that result from a skin reaction. The wells vary in size and appear and fade repeatedly as the reaction runs its course. For example, kumain ka ng seafoods, hindi mo pala alam na allergic ka, biglang lilitaw ang urticaria sa balat mo.
To continue, vesicle. Ang vesicle ay circumscribed fluid-filled lesions less than 5 mm. Ang vesicles ay pwede siyang mag-appear sa ating balat pag may natrap under the epidermis. Ito ay mas maliit lamang at may fluid sa loob na ang kulay ay pwedeng clear, white, yellow, or mixed with blood. Vesicles are also sometimes referred to a blister or bullae. True, there are slight size differences among the three. Bullae. Ang bullae naman ay parang same lang siya sa vesicles from the word more than. Ang bullae ay mas malaki. Ito din naman ay nag-a-appear when the fluid is trapped under the thin layer of the skin, and they are both called blister. Purpura. Purpura is a skin lesion due to bleeding into the skin. The spot may also appear on organs or mucous membranes, including the membranes on the inside of the mouth. Purpura occurs when a small blood vessel bursts, causing blood to pool under the skin. There are two types of purpura, the petechia and ecchymosis. The petechia is less than 3 mm in diameter. So kapag ang petechia ay nag-appear sa ating balat, Ang petechia ay mas maliit di tulad ng ecchymosis. Ang ecchymosis kasi ay is more than 3 mm diameter, so mas malaki ito.
Pustules. Pustules is a circumscribed exudate-filled lesions. Pustules is a bulging patch of skin that's full of a yellowish fluid called pus. It's basically a big pimple. Several conditions ranging from something as common as acne to the once deadly disease, smallpox, can cause pustules. Ulcer. Ulcer is a crater-like lesion that may involve the deeper layers of the epidermis and dermis. Ulcer is an open sore caused by poor blood flow. Good blood flow is necessary for wound healing. But if you have blood circulation problems or minor injuries, can't heal properly. Eschar. Eschar is a necrotic ulcer covered with a blackened scab or crust. Eschar comes from Greek word eschara. Eschar is a slough or piece of dead tissue that is cast off from the surface of the skin, particularly after a burn injury, but also seen in gangrene, ulcer, fungal infections, necrotizing spider bite wounds, tick bites associated with spotted fevers, and exposure to cutaneous anthrax.
Next is bacterial skin infections. Introduction to bacteria. Bacteria are microscopic, single-cell organisms that live almost everywhere. They are among the earliest known life forms on Earth. There are thousands of different kinds of bacteria, and they live in every conceivable environment all over the world. Some are airborne, and the others are most prevalent in water, soil, plants, animals, and even people. Many strains of bacteria are harmless, and some are even beneficial, such as those found in the human gastrointestinal tract to aid digestion and produce vitamins. There are few or less than 1% of all bacteria types that cause illness in humans. Some bacteria can be quite dangerous, resulting in salmonella, pneumonia, or meningitis. The global problem of infectious and deadly disease caused by bacteria are presently major scientific and medical issues. Bacterial infections have a large impact on public health. As a general rule, bacterial infections are easier to treat than virus infections since we have an extensive army of antimicrobial agents with activity against bacteria. Bacterial resistance to antimicrobials is a rapidly growing problem with potential devastating consequences. The most deadly bacterial disease contracted by human beings is Mycobacterium tuberculosis, the world's leading infectious disease with more than 1,700,000 deaths per year. As much as 13% of cases are resistant to most antibiotics, and about 6% are resistant or unresponsive to essentially all treatment. Symptoms of a bacterial infection. Children and adults of any age can develop a bacterial infection. Bacteria can infect any area of the body, including the skin, bladder, lungs, intestines, brains, and more. A bacterial infections can also spread throughout the blood, causing a condition described as sepsis. The symptoms of a bacterial infection will depend on the location of the infections and the type of bacteria. There are some general signs of bacterial infections: fever, feeling tired or fatigue, swollen lymph nodes in the neck, armpits, groin or elsewhere, headache, nausea or vomiting. Staphylococcus aureus is a common pathogen in humans. They are gram-positive cocci, usually arranged individually in pairs, short chains, or in grape-like clusters. It is found in the skin and the nasopharynx. Mode of transmission. Skin infections are transmitted through direct contact with the person having virulent lesions, from hands of healthcare or hospital workers, and through fomites like bed linens and contaminated clothing. Impetigo is a very contagious skin infection. The infection can be acquired by direct skin-to-skin contact with an infected person. So you can also get it by using an object, such as towel that's been contaminated with the bacteria. Stye or hordeolum folliculitis occurring at the base of the eyelids. Staphylococcus aureus, other skin infection. Folliculitis, furuncle, carbuncle, staphylococcal scalded skin syndromes or Ritter's disease. Staphylococcus epidermis is one of the most abundant bacterial colonizers of healthy human skin. It is commonly associated with stitch abscess, UTI, endocarditis, and causes infections in individuals with prosthetic devices. Streptococcus pyogenes are gram-positive cocci arranged in pairs or in chains when seen under the microscope. Its major virulence factor is M protein, which is antipathogocyte. Pyogenes produce enzymes and toxins responsible for the pathogenesis of infections caused by the organism. Mode of transmissions. Soft tissues infections are acquired through direct contact or through fomites. Cellulitis is a bacterial skin infections but not usually contagious. You can get cellulitis when bacteria that are normally present on the surface of your skin invade the deeper layers of your skin through something like a cut, scrape, or burn. Necrotizing fasciitis involves in the deep subcutaneous tissue is also known as flesh-eating or streptococcal gangrene. It starts as cellulitis, then becomes villous and gangrenous. It spreads to the fascia, then the muscle and fat. It may become systematic and cause multi-organ failure, leading to death. Streptococcus pyogenes, other skin infections and complications. Pyoderma or impetigo, erysipelas or St. Anthony's fire, acute glomerulonephritis, rheumatic fever. Next is Pseudomonas aeruginosa. Are gram-negative bacilli arranged in pairs that are encapsulated. They are capable of producing water-soluble pigment. It is an opportunistic pathogen, a common cause of nosocomial infections or hospital-acquired and resistant to most antibiotics. And it is commonly associated with colonization of burn wounds and characterized by blue-green pus and exudes a sweet grape-like odor. It is also the common cause of inflammation of the bone and cartilage of the foot called osteochondritis following a penetrating injury. Other skin infections, folliculitis and secondary infections in individuals with ankle and nail infection resulting from immersion in contaminated water. Mode of transmission. A common mode of transmission is through the colonization of previously injured skin. Next is Clostridium perfringens. Are gram-positive bacilli that are anaerobic and rarely produce endospores. It produces four lethal toxins, namely alpha, beta, iota, and epsilon toxins. Alpha toxin is the most lethal because it acts as a lecitinase that causes lysis of erythrocytes, platelets, and leukocytes. This toxin also causes massive hemolysis and bleeding and tissue destruction. Clostridium perfringens cause soft tissue infections like cellulitis, suppurative myositis, and myonecrosis or gas gangrene. Gas gangrene is a life-threatening infection following physical trauma or surgery characterized by massive tissue necrosis with gas formation, shock, renal failure, and death within 2 days or onset. Mode of transmission is commonly transmitted by the colonization of the skin following physical trauma or surgery. Next is Bacillus anthracis. It's a gram-positive bacilli arranged individually or in pairs or long serpentine chains, giving them the characteristic bamboo fishing rod or medusa head appearance. Virulence of the organism is due to a polypeptide capsule which is responsible for invading
phagocytosis, and toxins edematoxin and lethal-toxin, both of which inhibit the host immune responses, and can also be used in bioterrorism. Mode of transmission is transmitted through inoculation into open skin from either the soil or infected animal products, ingestion of infected meat or milk, and inhalation of aerosolized spores. Majority of bacterial skin infections are treated by doctors, prescribed antibiotics like penicillin, oxacillin, macrolides, and cephalosporins. In some serious bacterial infections requires hospitalizations and surgeries. Preventing infection. There are many actions that you can take to prevent the spread of infections. Be sure to follow the tips below. Practice good hand hygiene. Wash your hands often, especially before eating or handling food, after using the toilet, and before touching your face or mouth. Get vaccinated. Many infections can be prevented through vaccines. Examples include, but aren't limited to, measles, whooping, cough, and hepatitis. Avoid sharing personal items. This includes drinking glasses, toothbrushes, and razor blades. Cover cuts of scrapes. This can lessen the chance that they'll become infected. Don't pick up scratch them.
What is fungal skin infection? A fungal infection, also called mycosis, is a skin disease caused by a fungus. There are millions of species of fungi. They live in the dirt, on plants, on household surfaces, and on your skin. Sometimes they can lead to skin problems like rashes or bumps. Superficial mycosis. Tinea vesicolor, Tinea nigra. Tinea vesicolor, caused by Malassezia furfur. Malassezia furfur, normal flora of the skin, particularly in areas rich in sebaceous glands. Common fungal infection of the skin interferes with the normal pigmentation of the skin, resulting in small, discolored patches. Patches may be lighter or darker in the color than the surrounding skin and most commonly affect the trunk and shoulders, not painful or contagious. Tinea vesicolor symptoms. Patches of skin discoloration, usually on the back, chest, neck, and upper arms, which may appear lighter or darker than usual. Mild itching, scaling, causes hot, humid weather, oily skin, hormonal changes, weak immune system. Tinea nigra, caused by Hortea wennerkii, dermatitis fungus that produces melanin and grows as mold-producing annelids or Anneloconidia. This fungus is found in the soil, sewage, and decomposing vegetation of tropical or subtropical coastal region. Causes painless, brown, or black patches to grow on palms and feet. Painless and harmless. Tinea nigra. Symptoms: brown or black patch resembling a stain that usually occurs on the palm of the hand, or more rarely on the sole of the foot. The patch is generally flat with defined borders. The darkest area of the patch is at the edges. Shading gets lighter as it extends inward. This darker outside area may look like halo. The lesion is slow-growing and usually appears on only one hand or foot. Causes: direct contact with the fungus is necessary for transmission. Fungus can infiltrate skin via open wounds or cut. Tends to thrive on wet, clammy, sweaty skin, which is why the palm of the hand and the soles of the feet seem to be common target for the infection. Cutaneous mycosis. three genera that cause these infections. Microsporum infect the hair and nails only. Trichophyton infect the skin, hair, and nails. Epidermophyton infect the skin and nails only. Cutaneomycosis. Tinea pedis athlete's foot. Tinea capitis scalp. Tinea corporis body. Tinea crucis or jack itch groin. Tinea manum hands. Tinea barbae bird. Tinea uguum or onychomycosis nails. Tinea pedis fungal infection that usually begins between the toes, commonly occurs in people whose feet have become very sweaty while confined within tight-fitting shoes, contagious, and can be spread via contaminated floors, towels, or clothing. Tinea pedis symptoms: scaly red rash. The rash typically begins in between the toes. Itching is often the worst right after you take off your shoes and socks. Some types of athlete foot feature blisters or ulcers. The infection can affect one or both feet and can spread to your hand, especially if you scratch or pick at the infected parts of your feet. Causes: caused by the same type of fungus that causes ringworm and jack itch. Damp socks and shoes and warm, humid condition favor of organisms growth. Contagious and can be spread by contact with an infected person or from contact with contaminated surfaces such as towels, floors, and shoes. Tinea capitis fungal infection of the scalp and hair shaft, appears as itchy, scaly, bald patches on the head. Highly contagious infection is most common in toddlers and school-age children. Some cases of ringworm of the scalps result in severe inflammation at the site of infection that may cause scarring or permanent hair loss. Tinea capitis symptoms: one or more round patches of scaly skin where the hair has broken off at or just above the scalp. Patches that slowly expand or enlarge. Scaly gray or reddened areas. Patches that have small black dots where the hair has broken off at the scalp. Brittle or fragile hair that easily pulls out. Tender or painful areas on the scalp. Causes: caused by one of several varieties of mold-like fungi called dermatophytes. Spreads through direct skin-to-skin contact with an infected person. Can spread through contact with objects or surfaces that an infected person or animal has touched, such as clothing, towels, bed lines, combs, or brushes. Other animals that are often carriers of the fungi includes cow, goat, pigs, and horses. Tinea corporis ringworm of the body is a rash caused by a fungal infection. Red, itchy, circular rash with clearer skin in the middle, related to athlete's foot, jack it, and ringworm of the scalp. Tinea corporis symptoms: a scaly ring-shaped area, typically on the buttocks, trunk, arms, and legs. May itch. A clear or scaly area inside the ring, perhaps with a scattering of red bumps. slightly raised, expanding rings, round, flat patch of itchy skin. Overlapping rings causes contagious fungal infection caused by common mold-like parasites that live on the cells in the outer layer of your skin. Spreads by direct skin-to-skin contact with an infected person by touching an animal with ringworm. Tinea cruris. Jack it. Tinea cruris is a fungal infection that causes a red and itchy rash in warm and moist areas of the body. Often affect the groin and inner thighs and may be shaped like a ring. Jack itch gets its name because it's common in athletes, common in people who sweats a lot or who are overweight. Tinea cruris symptoms. Jack itch usually begins with a reddened area of skin in the crease in the groin. It often spreads to the upper thigh in a half-moon shape. The rash may be ring-shaped and bordered with a line of small blisters. It may burn or feel itchy, and the skin may be flaky or scaly. Causes. The organisms that cause Jack itch thrive in damp, closed environment. Jack itch is caused by fungus that spreads from person to person or from sharing contaminated towels or clothing. It's often caused by the same fungus that causes athlete's foot. The infection often spreads from the feet to the groin because the fungus can travel on your hand or on a towel. Tinea manium. Tinea manium is a fungal infection of the hands. Tinea is also called ringworm, and manium refers to it being on the hands. Tinea manium is a slightly less common form of tinea, and you often contract it by touching your feet or groin if they are infected. Symptoms. The infected area on your hand will normally start small and gradually become larger over time. The infection will generally start on the palm of the hand and may or may not spread to your fingers and the back of your hand. The area infected with tinea will be itchy, red, and have a scaly appearance. The infected area may also peel and flake. Causes. By making contact with the skin of someone with the fungus. Can also get it when your skin comes into contact with a surface that has been contaminated by someone with tinea. Tinea barbae. Tinea barbae is due to a dermatophytic infection around the bearded area of men. Generally, the infection occurs of a follicular inflammation or as a cutaneous granulomatous lesion. It is one of the causes of folliculitis. It is most common among agricultural workers as the transmission is more common from animal to human than human to human. Main symptoms that occur when affected with tinea barbae is pimple or blister amongst affected area, swelling and redness around infected area, red and lumpy skin on infected area, crusting around hairs in infected area will occur. Hair on infected area will also be effortless to pull out. Tinea barbae can be itchy or painful to touch, but these symptoms do not always occur. Causes. The transmission of tinea barbae to human occurs through contact of an infected animal to the skin of a human. Infection can occasionally be transmitted through contact of infection animal hair on human skin. Tinea barbae is very rarely transmitted through human to human contact but is not completely impossible. Tinea ugium. Nail fungus is a common condition that begins as a white or yellow spot under the tip of your fingernail or toenail. As the fungal infection goes deeper, nail fungus may cause your nail to discolor, thicken, and crumble at the edge. It can affect several nails. Symptoms: thick, whitish to yellow-brown discoloration, brittle, crumbly, or rugged, distorted in shape, a dark color caused by debris build up under your nail, smelling slightly foul. Causes: fungal nail infection are caused by various fungal organisms or fungi. The most common cause is a type of fungus called dermatophyte. Yeast and mold also can cause nail infections, more common in older adults. Reduced blood circulation to the feet and a weak immune system.
Subcutaneous mycosis. The infection initially involves the deeper layers of the dermis and subcutaneous tissue. The later, the bone mode of transmission is through traumatic inoculation into the skin. There are 4 types of subcutaneous mycosis, which is sporotrichosis, mycetoma, rhinosporidiosis, and chromoblastomycosis. Sporotrichosis caused by Sporotrix scanki, produced by walk-in barefoot, minor trauma caused by thorn, freak, or splinter injury, and also known as Rose Gardner's disease, is caused by a dimorphic Sporotrix scanki that is found in the soil and decaying vegetation. Infection initially presents as a small nodule which may later become ulcerative and pustular. 2 weeks later, painless and subcutaneous nodules along the lymphatic drainage develops. Sometimes they may present as verrucous lesions and often misdiagnosed as malignancy of the skin. Chromoblastomycosis caused by Pielopora verrucosa, Cladosporium carioni, Rhinocladia aquaspersa. Involves skin subcutaneous tissue. Produce sclerotic body. Is characterized by verrucous nodules or plaques. The infection is insidious and may become chronic. The etiologic agents are all dermatiosis fungi. Mycetoma, also known as maduromycosis and madura foot, caused by true fungi. 2 types of mycetoma, which is actinomycetoma and eumycetoma. Actinomycetoma, white or yellow granules produced by Norcadia species, Streptomyces somalensis, Actinomadora madurae, and pink to red granules produced by Actinomadora pelletieri. Eumycetoma, this is a black granules produced by Madurella mycetomatis, Madurella crasea, Exopaella genselmae, Curvularia species. And the white granules, Pseudolescaria boydii, Aspergillus netherlands, Acremonium species, and Fusarium species. It frequently involves the feet and hands. The infection is characterized by the clinical trial of the tumefaction, granules, and draining sinus. Diagnosis is primarily based on the characteristics of the granules. This is the example of sporotrichosis.
Viral infection of the skin. Warts. Etiologic agent. Warts are caused by a DNA virus, human papillomavirus. There are at least 70 serotypes. The virus is capable of causing malignant transformation of the infected cell. Mode of transmission. HPV infection is acquired by direct contact, mucosal or skin breaks, sexual contact, and upon passage through infected birth canal. Clinical findings. Skin warts. Begin self-limiting proliferation of the skin that undergoes spontaneous resolution. These warts may be flat dome, shaped, or plantar. HPV types 1-4 are the most common isolates from the lesions. Frequently affected sites are the hands, feet, and common among children and adolescents. Genital and anogenital warts, also known as condylomata acuminata. Treatment and prevention. Treatment is removal of the lesion by surgical excision, cryosurgery, electrocautery, application of caustic agents like podopilin and interferon for genital warts. Avoiding contact with infected tissue prevents spread of the infection. Herpes simplex infection. The etiologic agents are herpes simplex virus types 1 and 2, DNA virus under the family of human herpes viridae. These viruses are capable of latency in the neurons and are capable of recurring infections. Modes of transmission. HSV is present in oral and genital secretions and vesical fluid. It can be transferred through oral contact like kissing, fomites, sharing of glasses, toothbrushes, and other saliva-contaminated materials. Sexual contact, transplacental during pregnancy and during childbirth. Gingivostomatitis, the primary infection caused by HSV-1. It represents a vesicle that ruptures and ulcerates. Lesions are seen in the buccal mucosa, palate, gingivae, pharynx, and the tongue. The most striking feature is gingivitis. Gingivostomatitis is common during childhood. Herpes labialis, fever blister or cold sore. It represents recurrent mucocutaneous HSV infection. This is caused by HSV-1 and 2. Lesions are usually located at the vermilion borders of the lip. Lesions are vesicular. They rupture, then form an ulcer, and later form crust. Are less severe than the primary infection and often occur on the same site. Herpetic whitlow. HSV infection involving the fingers are caused by both HSV types 1 and 2. Eczema herpeticum. HSV infection occurring in children with eczema. This only shows that HSV can be an opportunistic pathogen. It can also cause a superimposed infection in burns. Herpes gladiatorum. HSV infection of the body and is usually acquired during wrestling or playing rugby. Treatment and prevention. The recommended drug is acyclovir. There is currently no available vaccine for HSV.